Okay. So as we discussed last lecture that we are going to take theories. So I prepared for two theories, that is Florence Nightingale's environmental theory and second is raw adaptation model. So today we are going to cover the two theories and for advanced nursing practice. Okay. So it can be asked for Florence Nightingale theory or environmental theory. Her theory is based on the environment, so the environment which is surrounding the patient, how the surrounding environment helps the patient in healing process, or how the healing process is affected by the surrounding environment. It's her theory is based on this thing. That's why its name is environmental theory. So Florence Nightingale's environmental theory, Florence Nightingale, known as the mother of modern nursing, proposed the environmental theory in 19th century. So in 19th century, she came with this environmental theory. She is also known as mother of the modern nursing, as we know. According to this theory, environment plays a vital role in the healing and recovery of patient. Yes, we know this. Environment plays a very important role. If there is a person who is not feeling well, who is ill, and he is staying at the place which is not clean, or there is continuously chaos, noise, or there is not proper air, proper ventilation is not there, proper food is not there, proper water supply is not there, proper sanitation is not there. So what will happen? He will get more ill, right? But if it is vice versa, if there is pure air, proper air, fresh air, proper ventilation is there, good source of light is there. If this direct sunlight, that is well and good, and the environment which he is there, which he is staying, it is calm, quiet. The bed in which he is taking rest, it is calm, comfortable. So what will happen? This will help in recovering of the patient. The person who is ill, if he is getting a good environment which is surrounding, the surrounding of the patient is good, healthy, so it will help in the healing of the patient or recovering of the patient. Okay. She defined nursing as the act of utilizing the environment of the patient to assist in his recovery. So what she said that nurses should utilize the environment, the surrounding environment, to help the patient in recovery. What we can do, that the environment in which the patient is staying, if it is unhealthy, or if there are some deficiency which can be changed, so we should change. As a nurse, we should focus on this thing, and we can change this environment so that this environment will help in healing of the patient. Is it clear? Next, we will see what are the key concepts. So, first concept in this theory is health. Not just absence of disease, but ability to use every physical, mental, spiritual power to the fullest extent. So here, the health means what? Not only the absence of disease, but also when the person is able to utilize all its physical, mental, and spiritual power is known as health. Okay. Next is environment. So what is environment here? Here it includes all external factors, physical, psychological, social, that can influence patient's health positively or negatively. So that is true. Environment means external factors as well as internal also. Okay. But here the major factors, internally we can't change anything in patient. We can only give medicine, or the surgery can be done for internal environment of the patient, bodily internal environment. But what we can change, or what kind of environment is visible to us, that is the external environmental factors. So external environmental factors include what? Physical, physical of the patient, or the physically the things which you can see, that physical environment. Then psychological, patient how is stressed, anxiety, that is a psychological factor. And social, that are the relationship with the what we say near ones of the patient. Okay, so this environment, physical, psychological, and social environment, which by which the patient is continuously surrounded, this can affect patient's health, or this can influence the patient health positively or negatively. If these all are positive, the physical setup is good, proper lighting is there, proper water supply is there, proper sanitation is there, ventilation is good, then the bedding on the which the patient is lying, it is comfortable. So this is the physical environment. It is all good. And psychologically, patient is not that stressed because he has all the near and dear ones. He's having good relationship with his near and dear ones. All are there for taking care of him or her, and they are continuously what we say. Positively encouraging that person. So what is that? This all positive environment, external environment will help in healing of the patient. Okay. And if it is opposite, totally opposite, not good, physic physically, everything is not good, not proper water supply, food, bed is not comfortable, it is hard. So what will happen? Already the patient is ill, and all this thing will again increase that illness in the patient. Okay. So that will delay in the healing or recovery of the patient. And last is nursing. Involves manipulating the environment to promote health and support the patient's natural healing process. So, why the nurse is in the key concept? Because nurse can change this environment. Okay, if we so we know which and what there should be in environment which will heal in the which will help in healing of the patient. But if nurses is not there, who is going to see this factor? Doctors are busy in their work. What we say, the relatives, they are not so aware about that all these factors, right? So nurse are involved in changing these factors, environmental factors which is surrounding the patient. If any of this factor is not good or not helping positively, we can manipulate it in such a way so that it will help in healing of the patient or the process of healing in the patient. Is it clear? Next, we will see what are the main environmental factors. So, Florence Nightingale had stated some environmental factors which, if have which are positive, uh, as given as she has stated, if it is in that manner, it will help in healing of the patient. So Nightingale identified five essential. How many? Five. She identified five environmental essential factors that will help increase the patient recovery. Time of recovery will be fast enough by these five essential environmental factors. So, which are the five environmental factors that Nightingale has seen? First one is pure air. Air is pure. No, it doesn't involve any allergens or dust particles. If the air is clean, that time that and one of the environmental factor which will enhance or increase the recovery, increase the speed of recovery in patient. Second one is pure water. See, one of the main factor is water because our body is majority made up of water, and many disease condition where there is loss of water. Okay, body is having loss of water at that time. Also, and in regular way also, when the water is pure, it will help heal the body in increase, increasing the healing process. Next is efficient drainage. The facility of proper drainage should be there in wherever in the ward or the uh, room in which the patient is staying or admitted. Cleanliness or sanitation, cleanliness of the floorings, beddings, patient's cleanliness itself. This all, if it is maintained, it will help. This one of the environmental factor which will help in recovering of the patient. Light, and light, that is especially direct sunlight. Sunlight helps in the development of vitamin D, and many other factors also help. Patient will feel fresh if there is proper light source. See, for example, if we are staying in a room, it is not having proper windows or it is not clean and there is not proper light source. So how we will feel? We will feel dull. As the patient is already ill, he will feel dull if all this facility or all this environmental factor is working in negative way or are in negative point. Suppose air is not good, clean water is not there, drainage is not there proper, there is clogging of water in that particular room or where area where the patient is staying, then cleanliness is not maintained, there is no proper source of water. What will happen? It will hamper patient's health, right? We can't, as a normal human being also, this all will thing will affect. So already if the person is ill, so this all factors, environmental factors will affect the patient's recovery. Clear? If it is in positive way, it is good, then it will increase the speed of recovery, right? And last is some more important factors, other important factors which are also included in environment are proper ventilation and warming, quiet environment, which is very much important. For healing, we require calmness, okay? Proper sleep and all, how it will come when there is clean calmness, calm and quiet and silent environment. Okay, healthy diet. Internally, how we will heal when the body, which is requires some kind of nutrient for fight that infection or healing that particular wound, whatever the nutrient is required, how it is going to come from our nutrition, from our diet. And as a nurse, what we will do, we know that particular disease condition or illness require this kind of diet. That diet, as per the patient liking, we will prepare such kind of diet and give to the patient that will help in recovering from that illnesses and continuous observation of patient. So if we observe if we keep continuous observation of patient, what will happen? Due to observation, we can see that if there is any minute change, we can change it immediately, right? If there is any minor changes in patient's vitals, what we can do, we can immediately take action on it and will stop any future problems which may arise due to that changes, right? If we are not observing, not doing proper observation of the patient, it may hamper, it may happen that one of these signs we have missed and that may lead to future problems of the patient. So these are all the main environmental factors. First five main essential environmental factors which Florence Nightangle has stated were pure air, pure water, efficient drainage, cleanliness or sanitation, both of patient as well as the surrounding, light. These are the five important environmental factors which will help, which influence the healing of the patient or recovery of the patient. Clear? So here it is in a diagrammatic form. You can see it. This is a conceptual framework. So for by chance, if this theory came in exam, so you can draw in this manner. This is nurse, how she can alter, and this is the client. Bigger circle is nurse and smaller circle is client. And this is the environment which needed to be changed or which can be changed as per the patient's requirement or patient's need, and which will help in healing of the patient or recovery of the patient. Okay. Next is principles of the theory. So what are the principles of this theory? First is proper ventilation and temperature are crucial for patient recovery. Basic thing it is, we also can't stay in such a room which is not having proper ventilation or temperature is not proper. If it is too cold, if it's too hot, we can't stay in that environment as a normal human being also. Or there is no proper ventilation, we will feel suffocated. So same goes for the patient also. If patient is staying in a room which is having proper ventilation and temperature, his recovery will be easy. And it is one of these are the important factor in patient recovery, that is proper ventilation and temperature. Second is quiet and well lit environment supports healing. When the patient is in healing stage, if he is provided with calm environment and proper source of light, that will enhance his healing. Okay, healing will be very well if this quiet and lighting will be proper in that particular room. Cleanliness of the patient and surrounding prevents infection, right? If there is cleanliness, there will be no chance of spread of infection from environment to patient and patients itself, right? Cleanliness of both environment of the surrounding in which the patient is staying and patient's cleanliness himself or herself is also required to avoid the infection. Proper nutrition and regular observation are essential. That is true. Proper nutrition is given, so that will and add up in healing of the patient. Okay, for healing, whatever the vitamins or minerals are required, or for fighting the infection, the vitamins and minerals which are required for generating that kind of energy or factors in our body. Proper nutrition should be given as per the patient's illness, and continuous observation of the patient are the essential factors for the healing. Last is deficiency in this environment factor can lead to illness. As we have seen, this all the environmental factors help us helps the patient in healing or recovering, right? But if these factors are not properly maintained or there are deficiencies in environmental factors, so it will delay the healing process or recovery process in the patient. But the body can repair itself with the nurturing environment. And our body is such a nice place that it is continuously fighting for itself. Our body is internally continuously fighting for healing. But when we give our environment, when we give our body such an environment of healing environment, with all the source, proper source, then our body will repair itself more fastly as compared to other environment. Is it clear? So last point in this theory is relevance in modern nursing. So what is the relation of this theory to the modern nursing? Florence Nightingale environmental theory laid the foundation. So this is the base for holistic patient-centered care and infection control practice. Nowadays, we are seen that each and every specialization focuses on patient-centered care. Previously, it used to work, they used to work on disease condition, they used to work on illness, not on the person. Okay. But nowadays, means in modern nursing, what is the focus? Patient is the focus. So now uh, so this environmental theory is the base for this patient-centered care and holistic approach. Holistic means overall approach, not only that particular disease condition, patient's environment. Each and every factors is being studied or being focused due to this Nightingale theory and infection control practices. We have seen nowadays there is special course also. Infection control practices are also run by each and every nursing fraternity as well as hospitals so that it will help in healing or recovering of the patient as soon as possible. Her principles are still widely used in modern nursing, modern hospitals, highlighting the role of nurses as environmental managers who creates condition favorable for patient healing. So that is true. Yeah, this principle, environmental factor, it is widely used everywhere and it is going to be widely used here now in present also in future also because this factor is one of the major factor which helps in healing of the patient, okay, recovering of the patient. And it also highlights our role as an environmental manager because we see which and what is the environment around the patient, why the patient is not healing or why the healing is so slow. We will see, we observe, we see what is there in the environment which is stopping the patient in healing. So we can create such condition, favorable condition for patients healing. So this is the relevance of this environmental theory to the modern nursing. Is it clear? It's all about environmental theory of Florence Nightingale. Now we will move towards next, that is Roy's adaptation model. Okay, so
Okay, ma'am.
this theory is about adaptation. You must be knowing what is adaptation. Yes,
Yes.
right, right. What our body does or what we do when the environment changes, we try to adjust in that environment. And when we adjust and we go with that kind of environment, that is called adaptation, right? So on that basis, this theory or this model was developed by Callista Roy. So let's see about it. So first is about the introduction of this raw adaptation theory in nursing. Roy's adaptation model, also called as RAM, huh, developed by Sister Callista Roy in 1964. So this theory was developed by Roy in year 1964. It is one of the most influential framework in nursing. Means this framework, this conceptual framework, is majority of time is used in nursing. Okay, why? Because when the patient is healthy and he get ill, there is something that patient changes. Changes is called adaptation. Adjusting is called adaptation, right? So this theory is based on day-to-day nursing framework or the patient day-to-day life. Clear? It considers people as holistic, adaptive system constantly interacting with the changing environment. So what it consider that people are what? Whole. Huh? It adaptive systems constantly interacting with changing environment. So person are what? They are a whole. Whole person is a constantly, continuously changing according to the environment. Whenever there is, when the patient come in contact with different environment, at home the environment is different, at working places the environment is different, at social gathering environment is different, and in hospital when the patient is admitted, at that time also the environment is different. But the person continuously what he is doing is adjusting, he is adapting to this changing environment. So she sees that people as holistic adaptive system constantly interacting with changing environment. The focus of nursing according to Roy. So according to her, what is the focus of nurses here is to promote positive adaptation in individual and group. So here the nurses, as per her, nursing focuses on what? To promote, to encourage people when they are adapting positively the changes, adjustment which the person is making, if it is having positive effect on patient health. Such type of adaptation should be promoted by whom? Nurses, to enhance overall health and well-being. Is it clear? Next, what are the major concepts? So in what we say in environmental theory, there were three major concepts. So here there are four main major concepts which are uh, responsible for this model. Okay, first one is a person. So who is a person? Person is seen as a biophysical or social being. The person who is living, who can think, who can do as per the environment, who's as per the need, and the social being who lives with the society. Okay, so we as a per any individual, any human being, okay, capable of adapting to environmental changes, who is capable of changing himself as per the environmental need, you using coping mechanism. So we he uses very different types of coping mechanism to change, to adjust in that particular environment. So the person is in, as per the Roy model, person is who can change as per the environmental requirement, and who uses this as a coping mechanism. By using the coping mechanism, he changes, he adapts to the environment as per the requirement, is called as a person. Next is environment. So what is the environment in this theory? The world around the individual, which provides stimuli requiring adaptation. Simple, it is very simple. Environment. The patient, the person is surrounded by some kind of environment. It can be any kind of environment. That environment which pokes him to change will always makes that person to adjust or tries him to adapt to new changes which will help in healing. That is the environment in this theory. Okay, environment which will provide the stimulus, which will give some force to the person, which will that force will encourage the person to adapt to the changing environment or as per the need of the environment. Okay. Next is health, a dynamic state representing the process and outcome of adaptation across a health illness continuum. So here the health is what? Here health represents the process and outcome of adaptation. How was a person what is the process in the adaptation of that person, and what is the outcome of that changes. Okay, so the patient was a person, due to his alcoholic condition, he got liver illness. Okay, health issues related to liver. And when he saw that he's suffering from this illness due to his habit, he changed that habit. He stopped having alcohol, and that lead to a proper health. So this overall, from starting of adaptation to the uh, effect of that adaptation on patient health is the health concept in this theory. Next is nursing, that is us. The goal is to facilitate and enhance adaptive response to achieve optimal health. So here the nursing focus on what? The goal of nursing here is to encourage and enhance, to increase adaptation behavior to positive adaptation in response to optimal health, to in response to gaining of proper health in the patient. For that, whatever the changes are required, the facilitate to provide that kind of environment or force or help to the patient is nursing in this theory. Clear?
So, adaptive mode in Roy adaptation theory describes four simple ways in which people respond to life changes or challenges. Each mode represents a different aspect of a person that needs to adapt for good health and well-being. So first one is physiological mode. In that, physical functioning and basic physiological needs. It means this mode is about that the physical need of the body. It includes thinking like things like breathing, eating, sleeping, and movements. Nurses help patient. Nurses will help patient in adapt by making. Nurses helps patients by making sure their basic bodily needs like food, water, and rest are met. Example for physiological mode is when someone is sick and has fever, they rest and drink fluid to help their body recover. Nurses may monitor their vital signs and ensure they get medicine and proper nutrition. Okay. Next one is self concept mode. Psychological and spiritual aspect including self esteem and self image. It means self concept mode is about how people feel about themselves. This include confidence, body image, self-esteem, and beliefs. Nurses support adaptation by encouraging patient to have a positive attitude and self-image. Okay, and example for this is a patient who has lost their hair due to chemotherapy may have struggle with how they are looking and all. The nurse can support them by encouraging positive thought and about self acceptance about their health. Okay. Third one is role function model. The role functions fulfill in society. So role function mode deals with the people's role they play in their life, daily life, such as being a student, parent, or worker, or a friend. It includes responsibility and expectation and from others. Nurses help patients to adapt to changes in their roles, especially during illness and life transition. Okay, so how when uh, during illness, how their role get hampered in that situation when nurses try help the patient to adapt in that situation or in that illness is what is the role function mode. Example for is when a parent breaks a leg, they may not be able to take care of their children as usual. Nurses help by teaching family member to share responsibility while parents is recovering. Okay, here the good example is of Punnabhai MBBS movie. You can take an example from that Azhar, how his life means how he got stressed due to his illness, that how the family will work, because he was the sole earner of the family. Okay, but here there is no, means in that movie there was no nurses support, but how that Sanjay Dutt hugged him and told him that everything will be all right, and how the situation will be back to normal. It was not that it had happened in that manner only, but how the role function mode, in that nurses can help. We can help the family, or we can make them understand that how they can help the in sharing the responsibility whatever the person or the ill person is having in the family. Okay, last one is interdependence mode, that is relationship and social support system. So, interdependence mode is about relationships and social connection. It covers how people give and receive love, support, and respect from family, friends, or community. Nurses will help patient to adapt by strengthening these relationships and building support system. So, here our role is to help the patient to adapt by making them strong in these relationships and building support system for them. Example again will be a patient if he's feeling lonely after being hospitalized. This had happened majority during the COVID system. Okay, uh, because no one was there with the patient. Patient was so individually alone, was majority of the miss during that time. Family wasn't allowed with the patient. Okay, the person or the patient who is admitted will always feel lonely if there is no family or near dear ones near to them. Okay, nurses can encourage family visits or help the patient to make calls to friends, strengthening their emotional support. Here in during COVID situation, we can communicate with patient, or they can have a direct call with the patient, family members, so that they will have emotional support. So this is these are the four adaptive modes, and these are about adapting: physical, that is bodily; emotional, that is self; socially, roles; and relationally, relationships, to stay healthy and cope with challenges.
Diagram explanation. The raw adaptation model diagram can be visualized as a system model with three main parts, that is input, control process, and output. So input here is the stimuli. There are three things that affect the person from the environment or within themselves. There are three types: focal, contextual, residual. Focal stimuli means the main immediate stimuli, example pain, surgery. Contextual stimuli, other factors that contribute, example age, fatigue, anxiety, will contribute to this stimuli. And third one is residual stimuli, that is unknown or subconscious factors such as belief, attitude of the person. So this stimuli enter the person's system and it leads to second step, that is control process. The control process are the coping mechanism that manage incoming stimuli. There are two types: regulatory stimulator, this subsystem, regulatory subsystem, or cognitor subsystem. Regulatory means autonomic automatic physiological response, example increase heart rate during stress. And cognitor subsystem means mental and emotional coping, such as example is thinking positively about the recovery. This process helps produce an adaptive or maladaptive response. Output is the behavior response, so the person's observable response to stimuli. Adaptive response promotes integrity, example healthy coping. Ineffective response threatens integrity, that is maladaptation. These responses are seen in four adaptive mode that we have seen earlier. And last is the feedback loop. The output responses provides feedback to the person and environment. This feedback helps the system adjust to maintain adaptation in a continuous cycle. So now we will see the nursing process in um, adaptation mode. What do you say? Raw adaptation model. Okay, model uses a six-step nursing process. So this nursing process, majority of time, we have to use in clinicals. Maybe you have assignments of nursing care plan or care case study, case presentation. In that, they tell you to apply theories. Okay, so where and how you can apply this theory. So first, so how raw adaptation can be utilized in nursing theory. The first one is assessment of behavior. Understand patient response in the adaptive mode. So nurse should observe the patient's action in each adaptive mode, physiological or social, emotional, or during functioning or shifting of his roles and interdependence, that is the relationships. Okay, during this, whatever the patient's action are there, how the patient is responding to the changes, the nurse should observe that. The nurse should observe the patient responses to this patient's action to these changes. Okay, adaptive mode. They compare this behavior to normal values to determine if the patient is adapting well or struggling. Right, it is there. See, if the patient action to that stimuli was good, okay, so that is the positive adaptation. But if the response was not good, the response was negative. So that shows the person is having what? The person's adaptation is not positive. Clear? Next one is assessment of stimuli. So what is stimulating this behavior of the patient? Why the patient actions are this? What is the stimulus? So assessment of stimulus. Determine the focal, contextual, and residual stimuli affecting the adaptation. So nurses should identify factors affecting patient's behavior. This can be focal, contextual, or residual. Focal means the main issue or direct cause, such as pain or from the surgery. Sometimes due to the pain, the patient responses are or actions are changed. Okay. Next is contextual stimuli. Uh, condition at condition present at the same time, like family stress, living condition, okay, surrounding. That what I told. Circumstances at during that present situation, what was the circumstances that patient acted in that particular manner. And last one is residual stimuli, that is the attitude that might affect the patient's adaptation. So patient's past experience or attitude, the patient's attitude towards that particular stimuli. If the attitude is not good, the adaptation will also be not good. Or his past experience to that stimuli was not good, he will respond in that particular manner. Clear? Okay. Next is nursing diagnosis. So identify ineffective adaptive responses. The nurse decides which behavior are ineffective, identify reasons for problems, and writes a diagnosis that links causes and observed behavior. So in nursing diagnosis, what we will do, we will see which behavior was not effective or which was not right. And we have to identify what was the reason behind that particular behavior or what was the problem and write, and on the basis of that problem, we have to write the diagnosis. Okay? Okay. Hmm. Next is goal setting. Collaborate with the patient to establish adaptive goal. So nurse and patient, when they are working together, the Nurse and patient work together to set clear, achievable goal to improve or resolve the patient ineffective responses. So to the stimuli, when the patient responds or there is some action of the patient. So how the action of the patient was there. Okay. Why the so we nurse and the patient should communicate and see, and we have to set the goal based on the behavior. The response was not good, so how we can change that? For that, we have to set the goals for the patient. We have to communicate with patient how we can change this particular response of the patient or the behavior of the patient in particular to that stimuli. Okay. So here the nurse and patient will work together to set clear goals, achievable goals to improve or to resolve patient's ineffective responses. Okay. We will set together, set the achievable goals to change the responses of the patient, the responses which will be effective to him. Next is intervention. Interventions modify stimuli and promote adaptive mechanism. So here the nurse, what she will do, nurse will take action to help the patient. Here interventions we know. We will try different kind of remedies, okay, interventions for the patient. Now here we have to change the stimuli, modify the stimuli, and we have to promote adaptive mechanism. So what we can do, we will take different actions to help the patient to adapt, often by changing or managing the stimuli, such as if the patient response was due to pain or due to some emotional problems or due to not having a proper coping mechanism. So what we can do, we can, if the pain is was the problem or different health issue was the problem, we have to resolve that problem. Okay, it may be fever or whatever internally patient is stressed also, so we have to find the therapies which will relieve that patient's stress, so his response or behavior will be changed and it will have a positive adaptive behavior. Clear?
Yeah.
Planning interventions. Interventions, we are going to plan interventions as per the patient's need. And last is evaluation. So in evaluation, assess the outcome of intervention and modify care as needed. So as in evaluation, what we see, the goal which we have set are met or not. So we are going to here again see that we have set the goals, that where there will be the change in the behavior or response of the patient to the stimuli, right? That goal have been achieved or not. We will check whether the set goals have been met and assess changes in patient behavior. If the adaptation is still ineffective, if the adaptation is not good, we will again start revising the plan and again we will plan some different intervention for the patient for proper achieving of the goal in the evaluation process. Understood? Next is application in practice. In practice, Roy adaptation model enable holistic, individualized, patient-centered care. Nurse evaluate the patient as a whole, assess the multiple influence on the adaptation, and provide care that support effective coping and adaptation. So what here this model help us to look overall patient, okay, individual patient completely, his environment, different kind of stimuli he's getting, his physical health, his emotional health, his relationships, his role. These all things are being focused while giving care to the patient so that the adaptation which the patient is going to have will be positive. Okay. The model is widely applicable in chronic care, community health, and specialized settings like rehabilitation and oncology. So this model is majoritarily used in which kinds of patient, when the patient is suffering from any chronic disease or there is some community health problems. So community health nurses. can use this model, and specialized settings like rehabilitation and oncology. So, sir, there are your rehabilitation unit. Rehabilitation is used for what? There will be some adaptation. The patient need to adapt what the illness has changed in his made changes in his bodies. To adapt that changes, he will require rehabilitation. So in that place also this model can be used. And in oncology, especially in cancer patient, majority of time cancer patients suffer from a long-term illnesses stays, and which affects their thinking, stress, and all every aspect, physical also, social and emotional also. So at that place, this theory can be applied. Okay. So conclusion. So conclusion. Raw adaptation theory is foundational in guiding modern nursing practices and education. It promotes holistic adaptive care and empower nurses to support patients in achieving highest level of functioning and health possible. So this adaptation model, see how whenever the patient is ill, getting recovery, so he need to make some changes in his life for positive health, for good health, for proper functioning, right? So this model helps in adaptation. So we can utilize this model for achieving highest level of health in the patient. Okay.